The purpose of this podcast is for us to go through each individual line on this certificate. Some treating doctors and most patients really don't even look at this. So this podcast will be a good education session for patients to go through each line by line to ensure that the lines are filled up correctly. Because again, this certificate is potentially in breach of Section 44B, and the insurance company can deny this.
Before we begin, can I have a minute of your time? In Australia, every few minutes, someone gets injured at work, on a work site, in a warehouse, on the road, and in an office chair that they've sat in for over 10 years. And most of these injuries, they were preventable. Our podcast exists for one reason: to have an open conversation about work, safety, and our compensation system. We talk to experts in our field to discuss the good, the broken, and what to improve within the system. Because safety isn't paperwork, it's people, it's the family, it's our future. So if you learn something new from this episode, make sure you subscribe to the Ausrehab podcast. And if you or someone you know has a powerful story about injury, recovery, workplace safety, or any related topics, reach out to us. We're always open to guests who move this conversation forward in Australia. Now, let's get into today's episode. Welcome back to another episode of the Ausrehab podcast. Today, we've invited Dr. Tang back due to popular demand. We saw your PMs, we saw your emails, we saw your questions. Now we're getting him back to talk more about a lot of topics. We're going to cover COCs, certificate of capacities, compliance for notifications, insurers, all that stuff, as well as patients' rights. And without further ado, let's go and kick into COCs.
Great. Thank you, Stephen. Thank you again for the invite. We can start. How would you like to proceed?
Look, we've prepared a few COCs from our line of work, and we've got 5 right here. Let's run them through it, and then tell me what is good and what is bad, and what do you see, in your capacity as IMC, what's wrong with them?
Sure. Look, thanks again. Look, I'll comment on these certificates based on me being a nominally treating doctor and also as an IMC, and what I actually look for in a certificate. Now, the certificate of capacity is one of the most important documents that an injured worker, a nominally treating doctor, and an insurer would want to have and see. So it's very important that that as nominally treating doctors, that we fill out the certificates properly.
If you're listening to us on Spotify, switch to YouTube. Then you actually see the screen recordings as well.
So let's go through this one. So this is the first one that you've provided for me. So I'm just looking through this now. The first thing you look at is this first tick here. Now, one of the common mistakes we see is that this tick is not removed. So if it's a first initial certificate, we always need to tick this. And then for subsequent certificates, these ticks should be removed. So this one here has been removed. So at first glance, I can say that this is a subsequent certificate. The name's been already redacted, which is great. So another common mistake is that the occupation is not provided here. So here it says we're aware that this patient is an office manager. We don't know who the employer is. Now, if it's a work cover claim, we always should put down the employer, because it's the employer who's paying for the insurance for this claim. So if it's been left out, it could be for the fact that they don't know who the actual name of the employer is, or if it's a CTP claim. I should also mention that the certificate is both for work-related injuries and also CTP. Now, if we go down to the second part where it says injured person's consent. Now, I'm going to go through just the CTP component, because I get a lot of questions from from patients and even rehab providers in regards to this. Now, this consent that you're signing on the first page is actually optional. So I'm actually circling here. I'm not sure if you can see this, but it actually says optional for CTP claims. So if this is a motor vehicle accident, you do not need to provide consent for the employer to actually understand what your injuries are. However, if it's a work-related injury, which is what we're talking about mostly today, the signature needs to be signed. Now, this signature allows the treating doctor, the employer, the insurer, and other medical practitioners, allied health providers to actually discuss you as a patient in regards to your claim and how they can actually help you with your recovery. Now, as an IMC, when I actually call doctors, they usually say that they need their patient's consent. Now, as a treating doctor, we need to understand that if an IMC or any other allied health provider or anyone that's related to the claim calls the non-treating doctor to discuss the claim, the non-treating doctor actually has the right to actually discuss the claim and the claim only. So there's no breach of privacy in this case. So once the patient signs this signature here, and this happens at the first instance, then the patient has already consented to you as a nominally treating doctor to discuss the case about your patient to anyone that's involved in the claim. Now, again, I stress again, it's optional if this is a CTP case. So if it's a CTP case, as a nominally treating doctor, you do not need to provide any information to the employer unless specifically provided by the injured worker. Now, Section 2, this is a big contention here. So if you look at Section 2, the medical certification, it says diagnosis of work-related injury / disease or the motor vehicle-related injuries. This is a CTP incident in this case here. Now, as a treating doctor, we need to provide the injury that's related to the workplace or motor vehicles injuries. So we need to provide a diagnosis that's specific to the work-related injury. Now, if you look at this, we see this a lot. As an RMC, I actually see this quite a lot. And Stephen, I'm sure that your rehab providers see this a lot as well.
Absolutely, yes.
If you look at this, anxiety / stress. Now, let's talk about stress first. SERA actually specifically stipulates that stress should not be provided in the diagnosis section. Stress cannot be included in any part of the claim. Now, as a doctor, we need to understand that stress is not a diagnosis. Now, the second part is most doctors provide this as anxiety. Now, anxiety in itself is not a diagnosis. I know it's widely accepted in the medical community when they use the word anxiety. But under SERA guidelines, we need to actually provide a clinically appropriate diagnosis. So anxiety in this case is not a diagnosis.
What would make it a clinical appropriate anxiety diagnosis?
When you provide a psychiatric diagnosis, the accepted diagnosis under what they call DSM-5. So DSM-5 is a psychiatric manual where doctors use this to provide a diagnosis. So an accepted diagnosis will be a generalized anxiety disorder. So the problems I can see here with this certification alone is anxiety and stress is not a diagnosis. So why does this diagnosis matter? Because the insurance company needs to understand what the work-related injury is in order for them to actually determine that you actually have an injury. Now, if there's no injury, then there's no claim.
Correct. So I remember last time you actually said Section 9A is the relevant legislation regarding specifically this part, whereby if there's no injury, there can't be a compensation for event.
What Section 9A says is that the injury needs to be a substantial contributing factor from the employer or the employer.
The work. It's fine.
Work is a substantial contributing factor to the injury.
Correct.
So hence, there's actually a specific definition of the injury as well. So again, in order for the insurance company to understand the injury, we need to provide a clinically appropriate diagnosis. So in this case, it doesn't pass the Section 9A test because there's no diagnosis and there's no injury. So this makes it very difficult because when we look at things like this, and if I was a case officer, I would look anxiety / stress and I might say, look, this is not an injury and there may not be a claim.
I think we should also point out, I think most case managers and case officers actually don't pick up on this. And they will just let it through, as in like these claims will just let it through. Like for this one, for instance, someone has let it through.
Cool. That's correct because for some reason they've allowed this claim to go through without a clinically appropriate diagnosis. Again, if there's no injury, there's no claim. Okay, so let's go for the next part where it says date of injury. In this case, it's been left blank. Now, the date of injury is actually very important, and I guess a lot of people are not aware of what it means. Now, the date of injury is based on if it's a psychological injury, it's based on the date at which the doctor or the patient first discovered the injury. So if you, Stephen, came and saw me today and you have a psychological injury and I will put down the date of injury as today, although that your psychological disorder or this stress was caused over multiple years of, in this, let's assume, psychological abuse in terms of bullying and harassment. The date of injury would be today. Now, there's a section of the Act called Section 15. So Section 15 of the Act stipulates that the date of injury is based on the date at which we first discover the injury, and hence we put down the date of injury. Now, as a treating doctor, I get a lot of kickback from this because the insurance company will say, well, hang on a sec. The patient hasn't been at work for the past month. The patient hasn't been at work for the past 12 months. How can the date of injury be today? Well, again, I relate to Section 15, where Section 15 stipulates that the date of injury is based on the date at which we first discover the injury.
I've got a question here. I've seen a few certificates that says something along the lines of, the certificate was made today. Say it was made today.
Correct.
And the date of injury was maybe like 2 weeks ago.
Mm-hmm.
Is that still correct?
Well, in this, it depends if it's a physical or
a psychological claim.
Yeah, if it's a psychological injury, if there's an identifiable date of injury, then we put the date of injury as 2 weeks ago. I guess where the date of injury is important in terms of Section 15 is, let's say, for example, degenerative changes. So I have a patient who's a truck driver. For the past 15 years, he's been jumping out of the trucks, develops pain in his knees, but he ignores it. Most truck drivers ignore this. He recently retired, and then 6 months later, he presents with significant degenerative changes in his lower back, his hips, and his knees. Comes in, we do an X-ray, and we say, look, you got osteoarthritis. Now, that can be linked back from the 15, 20 years of him as a truck driver, where he's jumping up and down, on the truck, climbing, prolonged sitting. So in this case, I would put down the date of injury as the date at which we first diagnosed him, which is, let's say, today, after I've organized for an X-ray, and the X-ray demonstrates he has significant degenerative change and osteoarthritis in his knees and his hips. Now, going back to the date of injury and why it's important, based on the date of injury, so let's assume the date of injury is today. If the date of injury is today, you have, as a normally treating doctor, I have 12 weeks to refer a patient to a specialist. So there's no need for pre-approval. So there's no need to get approval from the insurer. If it's more than 12 weeks, then we need to actually get approval from the insurer. So that's one of the important aspects of a 12-week date of injury. Now, if your date of injury was 12 weeks ago, and you put down the date of injury 12 weeks ago, then the insurance company can actually reasonably decline your claim. So anything more than 12 weeks from the actual date of injury, they can actually decline your claim.
Interesting. I actually didn't know this. Okay. And when you say reasonable decline, like you're talking about the first 7 days of whether they're provisional.
No. So reasonably excused. So let's say, for example, I put down the date of injury as 3 months ago. So you came and saw me, and I put down the date of injury 3 months ago. Now the insurance company can actually reasonably excuse your case immediately based on the date of injury. So looking at this certificate now, the doctor's actually put down that the date of first seen. So he or she's seen this patient on 19th of December 2025, which is great. Now, if you look at this, he's actually left out. He's actually left this blank, and it's very uncertain how this can go through. However, again, you only need to fill this out if it's an initial certificate only. So I'm assuming that the doctor would have ticked yes. So injury is consistent with the patient's description of cause. Now, if he ticks yes, then it means that the treating doctor supports that this is a work-related injury. If he ticks no, then it's not a work-related injury. If it's uncertain, it means that he or she may need further investigations to find out if it is related to work or not.
If it's left blank, like what would that?
Well, I'm not a case officer, but again, if you need to tick either yes, no, or uncertain in order for the case to go through. So if this was left blank, then again, it doesn't seem like this patient has a valid claim. Because again, Section 9A stipulates that employment must be a substantial contributing factor to the case. So in this case here, the doctor's actually left the blank. But then again, you only fill this out if it's an initial certificate only. So this I'm assuming is not an initial certificate. So let's assume that he or she did tick yes. Second part, how is the injury related to work? Now in this instance here, work or the motor vehicle accident. In this instance here, the treating doctors put down precipitated by noise pollution in the workplace. So this is what they call the mechanism injury. Now this is also very important. Now, as a treating doctor, I'm actually very well aware of this, and I provide the insurance company or on the certificate as much information as I can to describe what the mechanism of injury was and to ensure that the mechanism injury is related to the workplace. Now, the second part is details of any pre-existing factors. So if there's any past history of any other issues, we put that down. Again, this has been left blank.
Have you seen any mechanism of injury that's not related to a diagnosis?
Yes, all the time. And I guess you may have some samples with us with the next 4 certificates, so we can go through that in next
cool.
one. So let's scroll down now where treatment and type. So again, usually the treating doctor should write down what type of treatment or medication that the patient should be on. This has been left blank. Ideally, this needs to be filled out. Now, the referral to a health service or rehab provider, this has been left blank. Again, that needs to be filled out because if the patient has a psychological disorder, then there should be at least some form of psychological counseling to refer the patient to. Now, this brings me to the next part where it says capacity for activities. Now, I'll talk about this in my capacity as an IMC. Now, if you can see this in this instance, this has been left blank. Now, usually when I ask treating doctors why they leave this blank, they usually say that if the patient has no capacity for any type of work, they always leave it blank. But if you look at the instructions, Stephen, it says here, if the person has capacity for pre-injury work, then this section does not need to be completed. So this section for capacity for activities should only be left blank if the patient is fit for full duties. Now, if the patient is not fit for full duties, the treating doctor needs to provide what the capacity for activities is. In this case, what they can lift, how long they can sit for, how long they can stand for, how long they can push, how long they can bend, twist, and how long they can drive for.
Is it a standard practice to write every single one of them or comment on every single one, or can you leave certain parts blank?
Well, again, if you read the instructions, it actually asks you to actually fill out everything because we need to consider what activities of daily living the patients can actually perform. So ideally, I fill every single column. Now, the other column is for any other restrictions that you may not put through here. Now, let's go through where it says the next review date. Now, again, as a treating doctor, I get a lot of pushback from insurers, where they actually stipulate 28 days. They always say you need to put the review date for 28 days. And I can never understand why they keep saying 28 days. And if you look at this part here, it actually says if it's greater than 28 days, we need to provide a clinical reasoning. Now, this is actually highlighted in Section 44B of the Act, where it stipulates that we, as a treating doctor, you cannot provide a certificate for greater than 28 days unless we provide a clinical reasoning. So this review date is almost always reserved for the treating doctor to determine when it's clinically appropriate to review the patient. So if you believe that you need to see the patient the next day, then the review date will be in 24 hours.
And I think, you can probably go further and, go slightly more than that in terms of the idea is that at the acute stages of his injury, chances are you have to see a patient more than once.
Correct. Well, if it's an acute phase, yes, we see the patient a lot more regularly. I occasionally see them 2 times, sometimes even 3 times a week. And in terms of dressing, so for example, if it's a post-operative patient, we may see the patient on a daily basis to ensure that they're not getting any infections. And they get daily dressing. So this review date is not based on any magic number for the 28 days. It's based on what the treating doctor believes is clinically appropriate.
Yes, and we actually see that a lot. Like a lot of insurers and case managers somehow, for some reason, have that 28 days as the magic number. Every single certificate has to be 28 days.
Correct. But if you read the instructions, and it's actually in black and white, it's if greater than 28 days. Then we provide a clinical reason. There's no specific criteria where it stipulates that it must be 28 days.
And I think, I think it somewhat implies that each CRO wants the doctor to see them more than once.
Correct. More regularly than 28 days. Yeah. Okay, so moving on, where it says comments. So the comments is fine. So the doctor's written down on the comments what the doctor believes needs to be performed. Now, let's look at capacity for work. So in this case, we'll move straight down to where it actually says, so the doctor has ticked, has no current capacity for any type of work. doctors provided from the 30th of January to the 20th of February 2026. Now, this part here is actually quite important. Now, I've been guilty of leaving this out as well. But again, Section 44B, it lists in terms of what we need to actually provide. So if we provide a patient with no capacity for any type of employment, we need to provide an estimated time frame for the patient to return to some type of work. This is commonly left out. And like I said, I've been guilty of leaving this out. But now, if it's uncertain, I just put down uncertain at this stage because it's still quite too early to know.
I've also seen prognosis guarded as well as a comment.
Yeah, you can do that because we're unsure. We're unsure of when the patient will have the capacity to return to some type of work. Okay, so let's scrolling down here. So this is all fine. The treating doctor has ticked that he or she has agreed to be the treating doctor. The signature now, and employment declaration, and that's all I have to actually say about this certificate.
Cool. Moving on. Next one.
So the second one we have here is okay. So we have another certificate of capacity. So let's scroll down. Everything's been redacted. Signature, nothing wrong there. Okay, so looking at this diagnosis, the treating doctors put down the right wrist ganglion, which is okay. The date of injury has been left blank. It's always good to, well, in this case, they need to put down the date of injury so we know exactly how old this claim is. Because as an IMC, if I was to get this certificate, all I see is a blank a date that the patient was seen, and I don't know how old this claim is. So again, it's very important to actually at least put the date of injury there so we know how old this claim is. If the claim is a week old, then we know that it's still quite early. If the claim is 3 or 4 years old, then I know there's an issue there as well. Okay, so tick. So this is the second certificate, so there's no need to fill this part out. So going back here where it says hand specialist review, that's fine. Hand surgeon review is fine. Now, again, going back to, as we talked about before, where it says capacity for activities, you can see, Stephen, it's been left blank again. Now, when you leave this blank, it's very difficult for the insurers or any healthcare provider or anyone that's involved in the claim to actually understand what the capacity for activity is for the patient. Surely someone with a right wrist ganglion can use their left hand, can sit and stand and can at least drive, but this has been left blank. So ideally, again, this needs to be filled out correctly so it allows the insurer or anyone that's involved in the claim to understand what the actual capacity for activities is.
And I think, it's pretty important to point out that if you put some sort of a number there or a restriction there, we can track the progress over time.
Correct. So that was the purpose for the capacity activity. So when you provide serial certificates, each certificate may or may not demonstrate a progressive increase in capacity. Hence, the insurer or anyone that's related to the claim can see that there's been a slow recovery. In this case, it's been left blank, so it's very difficult for anyone to know what's going on here.
So say you're an IMC and you're looking into this case, what will you do to determine their tolerances? Well,
it's very difficult for an IMC to actually determine exactly what their lifting is, how long they can sit and stand for. I guess I can ask them, but it depends on what stage as an IMC I'm doing as well. But generally speaking, if we do what they call a stage 3, where I examine the patient, I can actually simply ask the patient how long you can sit for before you develop pain. Now, if we go back to looking at the fact that the diagnosis of the right wrist ganglion, then there shouldn't be any sitting tolerances and there shouldn't be any standing restrictions. It should be unlimited. Lifting, there would be a lifting capacity restriction with their right hand, but no restriction on the left hand. Again, with driving, so surely the patient can perform some form of driving depending if they can actually grip with their right hand. So again, this is very important. The capacity for activities allows everyone to understand what the actual capacity is. Again, it makes it very difficult for anyone that's related to the claim to work out what actually is going on here. So going back here again where it says the doctors here has put down no capacity for any type of work. Now, is this 28 days, 23? Now, if you can see, let's go through these, the dating. I believe that this may be, so 23rd of December.
That's 31 days, isn't it?
3, 4, 5. Yeah, so you can see here, you can see what the doctor's done here. So this is again, very typical of some of the cases I see. What the doctor's done here is he or she's provided aka a month. So the doctor believes that from the 23rd of December to the 23rd of January is 1 month, and he's provided a month certificate. But if you add this up, like you said, Stephen, it's greater than 28 days. So we go back to this part here, the next review date. If it's greater than 28 days, please provide a clinical reasoning. Now, the clinical reasoning here, I guess, recommended rehab consultant advisors. I don't believe that that's a clinical reasoning here. So I believe that this certificate is just placed on the fact that the GP has stated that it's just 1 month. Again, so treating doctors need to be careful. If they're going to provide 28 days, they should provide 28 days. If it's greater than 28 days, then technically the treating doctor needs to provide a clinical reasoning.
I also suspect, but maybe some doctors are, one is they might not know, that there's a requirement for 28 days, but the other, I suspect might be it's very hard to calculate exactly with 28 days.
Correct. It's just because treating doctors are time poor, they just place this 1 month dating, and then they leave it at that. But again, if the case officer wants to push it, they can. They say, well, it's greater than 28 days, we need a clinical reasoning, and they may not accept this certificate because it's in breach of Section 44B.
Do you have any tips on, work out exactly what 28 days is? Because usually for what I do is just go online, hop on Google, calculate days, and then
I just use my calculator. As you saw before, I just used my my calendar to work out the 28 days. And again, so if you look at this part, the next part, Stephen, it says no current capacity for work, estimated time frame, this has been left blank. So
it seems like this is a common occurrence,
yeah,
very common.
Yeah, it's very, like I said, the purpose of this podcast is for us to go through each individual line on this certificate. Most treating doctors, and or I should say some treating doctors, and most patients really don't even look at this. So I guess this podcast will be a good education session for patients to go through each line by line to ensure that the lines are filled up correctly. Yeah. Because again, this certificate is potentially it is in breach of Section 44B, and the insurance company can deny this.
And I have to, stress that probably most case managers don't know this, and they don't pick up on it, and then they just let it go. Let it through.
And it's possible, yeah. But if you do pick up on it, the case officer can say that this is a non-compliant certificate, therefore we won't be paying you wages. So that can affect the patient's wages.
Can I ask, in your experience, how many times have you seen that actually happen? As in a case manager goes, or case officer goes, this document is not up to a standard of, evidence, therefore I'm rejecting it.
Very few. In my experience, I don't know the exact number, but from my experience, very few actually deny this. But as an IMC, I actually pick this up, and I usually recommend to the case officer, this is a non-compliant certificate, so therefore wages may not be approved.
When you say very few, like how few? Like once a year, twice a year, 10 times a year?
I would probably say a handful, five times. Yeah.
So it's very little.
Yeah,
very little. Okay.
So we scroll down here. I agree. So in this case here, the treating doctor has not ticked this. I know this is semantics because the case officer may not even pick this up. But if you don't tick this, it means that you're not agreeing to be the nominal treating doctor. So therefore, you're not supposed to be signing anything else, like for example, return to work plans.
Yeah, I guess for people that are listening to this on anything but YouTube, it's a little box under the credentials of the doctor.
Correct.
Where it says, I agree to be a nominated doctor for the ongoing management of this person's injuries.
Correct. Now, going through Section 3 of the employee declaration, if you can see here, you can see that the patient has actually left this blank. So he or she has not ticked I have or I have not engaged in any form of paid employment. Again, if this has been left blank, the insurance company, again, can say that this is a non-compliant certificate, and so therefore wages are not appropriate. So I think that's all for this certificate, Stephen. Let's move on to
the next one,
the third one. Okay, so now this is another typical issue that I get. Now, if you look at this, a lot of patients don't even realize or see the difference. Now, if you look at this, it actually says WorkCover New South. It actually says WorkCover, and it actually says WorkCover New South Wales. Now, for patients out there who actually have this certificate, if you Google WorkCover New South Wales, it actually doesn't show up. So WorkCover New South Wales technically no longer exists. It's now run by the State Insurance Regulatory Authority. Now, this certificate is technically invalid. Well, it is invalid. So Section 44B also talks about a valid document. So the insurance company can say this is a non-valid document, so therefore this certificate is invalid and would not be accepted. So treating doctors need to provide a valid certificate of fitness, to ensure that the insurance company would actually accept this.
How does doctors ensure that they have the valid certificate?
Look, as an RMC, I always make this point. I always inform them that their certificate that they're providing is invalid, and most of them are not aware of this. Most of them say that their software doesn't have it. Well, most softwares do. I use Best Practice a lot. Best Practice has uploaded this software. I think it's over 10 years now. So I think WorkCover New South Wales transitioned into the State Insurance Regulatory Authority about 10 years ago. So this is technically a 10-year-old certificate and is non-compliant.
Now, so I think one of the contentions is 44B. You've mentioned it a few times. Let's run through the actual legislation and see what it actually says. Is that cool?
Okay, so as I spoke about this before, the WorkCover New South Wales certificate capacity is invalid. So I'll go through the section 44B, part 3A actually says that the certificate of capacity provided to the worker by a worker to the insurer be a certificate given by the medical practitioner in the approved form by the authority. So again, WorkCover New South Wales form is not approved form by the authority. It's a serious certificate that's approved. As we were talking before, Steve, in regards to this 28-day certificates. Now, if you look at section 44B, part 3, part B, it actually clearly states here that we should not provide a certificate for greater than 28 days unless there's a clinical reasoning. So again, I'm unsure where the insurance company always stipulates that we need to provide a certificate for 28 days.
It doesn't say should or shall not.
So certificate as to the worker's incapacity for work and whether the worker has current capacity for work or has no current work capacity during the period not exceeding 28 days.
Usually they don't say should, right?
No, it doesn't. It said during the period not exceeding 28 days. So when you certify the worker's incapacity,
it shouldn't be
not exceeding 28 days.
You're not basically just don't do it more than 28 days unless you have a clinical reason. What would be a common clinical reasoning for something like over 28 days? Well,
if the patient has stabilized, so if a patient's injuries say more than 6 months, and there's not much happening, there's no further treatment, or the treatment has remained stagnant, then you can actually provide 28 days. And usually we provide the clinical reason would be there's not much progress, so there's really no need to see the patient for within 28 days. So you can give 2 months, 3 months. So going through this again, so the patient's occupation has been left blank, and the employee details being left blank. Again, it's always good to know what the actual occupation is so we actually know what we're dealing with here. Are we dealing with a blue-collar worker? Are we dealing with a white-collar worker? It helps us a lot to understand what we can do next. Now, scoring through the diagnosis. So again, as an IMC, I see this a lot. And I think we touched on the first certificate where the diagnoses are not clinically appropriate. In this case, this is also not clinically appropriate because neck pain is a symptom. All it discusses is pain in the neck. There's no diagnostic criteria. We don't know what the work-related injury is. Now, one of the clues I look for the date of injury. So the doctors here put down the date of injury. So it's in September. So it's 3 months later, and we still have the diagnosis of neck pain. So when I usually speak to the treating doctors as an IMC, I usually ask them what the diagnosis is, and they usually say neck pain. And I usually explain to them that this is not a clinically appropriate diagnosis, and to provide a diagnosis that's related to the workplace. So again, as an IMC, it makes it very difficult to understand what we're dealing with. We don't know what the employee's occupation is. And we don't know what the diagnosis is 3 months after the date of injury.
And this is very common as well for physical injuries like these.
Yeah. So here, there's another confusing part here where the treating doctors has stated that the patient was seen on the 1st of the 9th, but the date of injury was 28 days later, which doesn't really make sense.
Oh, it actually says it's MVA, so motor vehicle accident. I guess maybe that's the reason why the employer name was left out.
That could be a reason, but I didn't see that. But it says here the patient was seen on the 1st of the 9th, but the motor vehicle accident was 28 days after. That doesn't make sense. But anyway, so the date, this date of injury and the mechanism, and the date of injury and the date of injury, the date when the patient was first seen, is not.
It doesn't match. It doesn't make any sense at all. So you're saying the car crash happened 28 days after they first saw it.
Yeah, so it looks like this doctor can foresee what's going on. But again, so you can see this is not a clinically appropriate certificate. Sorry, not a compliant certificate. And again, the insurance company will get quite confused because how can you see a patient 28 days before the motor vehicle accident?
And then more importantly, it does say WorkCover New South Wales. And I'm very sure CCP is not a part of WorkCover New South Wales.
Correct. So details of pre-existing factors, the doctor's left that blank, which is quite common. So the doctors here has left out treatment, left out referral to any other healthcare providers. So again, so here the doctors provided that the patient has no current capacity for any type of employment. Again, you can see, Stephen, he or she's put down 18th of December to the 18th of January. Again, it looks like it's just been fast forward 1 month rather than 28 days. And the time frame or estimated time frame for the patient return to work has been left blank. The doctor has said that he has recommended a referral to a workplace rehabilitation provider, which is great. Again, for the capacity for activities, we see this again quite often. The capacity for activities has been left blank again. We scroll down. And looking at Part C of the WorkCover New South Wales certificate, you can see that the patient hasn't ticked if the patient have or have not engaged in any form of paid employment. So again, this is a non-compliance certificate in terms of it's a not appropriate paperwork, and you can see there's multiple parts that the treating doctor and the patient has not completed.
Say an insurance company, a case manager looks at this. Usually what they will do, like what will they do if they see an invalid certificate?
Well, I'm not a case officer, so I don't know. But I do advise the case officers that these certificates are invalid. And because of it's invalid, it should not be accepted. So that's the only advice I can provide as an IMC. When I do speak to the treating doctors, I do advise them again that this certificate is invalid and they need to use a more valid certificate.
I think it's a shout out to, if any case manager want to come on the podcast and talk about this, come and reach out to us. It'll be awesome.
Great. Okay, let's move on to the next certificate. Okay, so here again we have a WorkCover New South Wales certificate, which is non-compliant. In this case, the doctors provided the patient's occupation. He's a field operations director. Employer's been left blank. And we go through here. Okay. So now looking at the diagnosis, the treating doctors put down bilateral knee injury that happened in the office, was walking, then twisted knees when turned to speak to colleague. MRI shows medial and lateral meniscal left knee, meniscal tear of the left knee. MRI right-sided medial meniscal tearing, ACL partial tearing. So again, I do see this sometimes as a treating doctor, so as an IMC. So this box here should only provide the mechanism. Should only provide the diagnosis. So in this case, the treating doctors provided the mechanism injury, and I suspect that he or she has provided the MRI reporting of the diagnosis rather than the actual diagnosis itself. Now, I need to stress that this diagnosis section needs to provide a diagnosis that's based on the work-related injury only. So looking at the diagnosis here, Stephen, it looks like what the treating doctors have done is he or she has provided the mechanism of injury, where the patient twisted their knees when turning to speak to the colleague, and the treating doctors also provided the MRI reporting, and I see this quite a lot. The box needs to provide a diagnosis based on the mechanism of injury, and in this case, it looks like it's a copy and paste of the MRI findings. And again, I find that a lot because most treating doctors can occasionally just copy and paste what the MRI shows, and then they paste on a diagnosis. I need to stress the diagnosis needs to be related to the mechanism of injury. Okay, so moving on. Date of injury was the
12th of January.
12th of January, and the shaded area was 18. Now, if you see this part here where it says how the injury disease is related to work, the treating doctors here is put down happened at the office. So happened in the office is not the actual mechanism of injury. So ideally, the treating doctor should have put down the twisted knees when turning to speak to a colleague at work. So yeah, so it's just that they place it in a different box. Now, the treating doctors here have actually stated that there is a pre-existing injury, which is in this case osteoarthritis. Now, the management, so the treating doctors provided everything on there, referral to the surgeon, and now again, the treating doctor provided the patient has capacity for 7.6 hours per day of work and 4.5 days per week, which is great. So again, here this looks like it's more than 28 days. So again, it looks like it's just they're just punching the date, and they're not aware of the actual 28-day capacity
requirements.
Limit.
Yeah.
Now, looking at the capacity, so he or she has provided most of them, except for the fact that the sitting and standing tolerance have been left blank. And scrolling down, so he ticks. So he or she's decided to be the treating doctor, and in here you can see now, Stephen, on the last page where it says Part C, the patient has ticked that he or she have not performed in any paid employment.
Yep.
Okay. Final certificate we have. Okay, so let's just scroll through quickly here.
So now we can see, I can see that it's a right documentations.
Yeah, so
it's the current one.
This is the most current up-to-date certificates issued by the State Insurance Regulatory Authority. So the treating doctors here has provided a PTSD, which is great, but apparently probably a little bit more information where it says it's work-related. Again, that should be left out. Mixed anxiety and depression is fine. The mechanism has been provided on this part on section 2, which is great. So conservative treatment. Okay, so again, capacity for activities have been left blank again. It will be good to have that filled out, so it allows everyone to understand what the progress of the patient is and how they're progressing, even if it's a psychological injury, because a patient with a psychical injury does have capacity for activities.
Yeah, I think, is it usual for psych injuries to have sleeping as one of the capacities down here?
Where was that? I can't see.
As in below driving abilities, there's other.
Mm-hmm.
Would you, as a NTD, put sleeping, and then we'll be
it depends.
Issues with sleeping or something.
Correct.
Because that's a very common issue with most psych claims.
Yeah, if it's relevant to the claim, yes, most definitely. So the doctors put down that the patient can work to 20 hours a week. The time frame looks great. So all in all, this is actually a reasonably good certificate. There's very minimal mistakes. I can only pick one or two. Now, I think that's all you have for the examples.
Yeah, no,
right.
I think what people should get is a lot of doctors and a lot of insurance companies, case managers, don't pick up on these mistakes, and I do think it is an issue for other treatment providers as well as essentially getting claims in. Maybe if they're more strict on it, then our work cover system won't be quote unquote as bad as in the state that they claim to be. We've learned so much today. If you have more questions, come and contact us. We will be able to help you. Like, comment, and subscribe to our channel. See you next time.